What is up guys, this is Mizar and you're tuning into my channel. If you're new to this channel, please don't forget to subscribe and hit the notification bell so that I get updated each time a new video is uploaded. Now in today's vlog, this will be my first sit-down video in my entire vlog series. So I will be talking about my struggles working in a ward. But without further ado, let's just have first an introduction. Okay guys, so we're back. Just a brief background about myself. I am a registered nurse in the Philippines. I used to work in the operating room, which is a specialized unit, for almost 3 years. And currently I am working in a different hospital, which is also here in the Philippines. So I am currently assigned in the floor or ward. The reason why I made this video is because I wanted to share to you guys my experience and also my opinion regarding on the working in a ward setup. So just a quick recap guys. I actually had a 12-hour shift and luckily I did survive. So I had my shift which started last night. That was 6 p.m. up until 6 a.m. this morning. So I just got home early today, and I feel out that too. I like to record myself and had this sit-down video and share my experience. Now, what it's like to be working in the ward setup. Well, for those who doesn't know about my background, I am actually a perioperative nurse. So based on my introduction earlier, I used to work in an operating room or the operating theater, and it's a specialized area which I help assist the surgeon and also help the other entire members of the team in performing specific cases or specific surgeries. Now, basically, what does this perioperative nurse do? So I'm just gonna give you some bird's eye view on what does an operating nurse really do. So if you are a perioperative nurse, so basically you know how to scrub, you know also how to circulate, and also sometimes you get a chance to take care of your patient right after surgery. And yeah, those are the 3 roles that you basically do as a perioperative nurse. Now, on my previous work experience, I used to work there in the operating room, and my role was, sometimes I do the role as a scrub nurse, which I help out the surgeon in performing the surgery and handling over the instrument to them, and also preparing the equipment needed on a specific surgery. And I also do the role as a circulating nurse, which prepares the operating room for that specific procedure. So say for example, craniotomy or like bone surgery. So they're the one also who prepares the room and prepares the patient as well in positioning. Now there's also one role that is also important. So once the patient is done with their surgery, the patient will be wheeled to the PACU or the post-anesthetic care unit. That is the department which the patient will be taken care of by the PACU nurses. So they are responsible in taking care of the patients, observing their vital signs, and also giving pain medications, and also monitoring everything that needs to be monitored, especially if they are under anesthesia. So they are placed in that room, and before they are wheeled in to their respective room or respective ward. Currently, I am working in a different hospital in the Philippines. I started my work there last Tuesday of this week. So today is Friday, I think Saturday. Yeah, it's Saturday today. And to be honest with you guys, it was really overwhelming. It was not really my first time to work in the ward setup, but my ward experience was not that solid I would say because of the fact that when I applied in my previous hospital, I was exposed in a ward for a couple of, like, I think that was only 20 days or 30 days if I'm not mistaken. And then right after that, I was assigned in the operating room because I actually requested to be assigned in the operating room. In the ward setup, you have only one role because you are the one who's taking care of your patient, and you're the one who's, you know, really on hands on that patient, and you know what's their management. So basically, guys, in the ward setup, you really need to use your brain. Literally use your brain. I mean, I'm not saying in the ward that you're not using your brain, because of course you need to, you know, do some. You really need to understand also the procedures and know how to intervene if in any case there's something going on or there's something happens during the procedure. But in the ward setup, you know, especially in the Philippines, it's really different. It's really different. That's all I can say. I don't have any other words to say, guys, but that's the only word that I can think of as of the moment. And medyo ngarag ako ngayon kasi it's just my third day in the ward, and I was assigned with 6 patients, I think 6 or 7 patients, but I was able to finish, and I was able to, you know, give the service that they deserve, of course, because that's actually what makes me happy. Providing quality service to the patient. Bahala na kahit medyo matagalan ako sa trabaho ko, and I was able to finish it on time anyway, so that's the most important thing. And yeah, given the fact that I'm actually working 12 hours, so it's a pretty much long shift, so we have 4 hours of extra shift or extra duty. And because in my previous hospital, which I was working, I only have 8 hours of shift per day, and it's actually divided into 3 shifts. That's morning, afternoon, and night. But this time here in my hospital where I'm currently working, they only have 2 shifts, which is the morning and the PM shifts, which they also cater the night shift. So that's why it's actually a long hour shift. So what's my struggle in working in the ward? Well, I actually listed some of the 3 things, my struggles working in a ward. First is managing my time. Well, way back when I was still a student, I used to manage my time really efficiently. I mean, because we were just only given 1 or 2 patients, and that just wasn't enough. And right now, I'm taking care of like 5 or 6, or some of my colleagues right now taking 14. Imagine 14 patients to 1 nurse. That's mind-blowing. I think in other hospitals, in the government hospitals, I don't know what's their ratio or how they do it, but they actually have like 20 or 30 30 patients to 1 or 2 nurses, because of the fact that nurses in the Philippines right now is depleting, because of the fact that some of the nurses who are just working, and then they just, you know, fly to another country to work because of they get a bigger salary, and that's a sad fact. But I'm also hoping in the near future, because I already had submitted my application to work abroad, so that's what I'm looking forward right now in the future. But as of now, since I am still here in the Philippines, so I still need to continue my nursing profession or my nursing career, so that I won't get idled for a couple of months while I'm waiting for my application. Going back to the point, my other struggle working in the ward. Well, second is that, yeah, I made mention about the time management. Well, time management for me in the working in the OR is way different because I know the zigzags and the do's and the don'ts in the OR. So I pretty much know what's set up in the OR. So I'm confident. If I will be assigned in the operating room in another hospital, I must say that I can survive. But in the ward setup, I mean, really guys, it's way different for me because I'm having a hard time right now in managing my time because it's still my third day, fourth day in a ward exposure. But hopefully I can manage it. But I cannot really see myself working in a ward because it's not that I don't like ward. There are some people who likes to work in a ward. But for me, I like to work in the operating setup because I just like taking one patient at a time and then surrounded with other other members of the healthcare team, the surgeons, anesthesiologists, and nurses. So yeah. Now the second point that I wanted to give you guys on my struggle. Like the paperworks. Paperworks for me in the operating room, though they have paperworks, but it's actually straightforward. So if you're a circulating nurse, you know what to do. You pretty much create nurse's notes, like call the laboratory if there are any laboratory that needs to be reviewed by the surgeon. So pretty much like it's actually really straightforward. Whereas in the ward, there are lots of documentation that you really need to write down on and sit down and take so much of your time. And sometimes taking of those documents, writing all those documents like the nurse's notes, charting, it's so overwhelming that sometimes you tend to lose time, like literally lose time, because of course you're writing nurse's notes or you're carrying out orders for by the doctor, and then after you carry out orders, you need to run to the room to your patient and regulate the IV or follow up the IV or give the medication, whatever you need to do. So that's basically my second struggle, the documentation process. Though it's not new for me because in the operating room there's also a documentation process, but in the ward there's so many things that you need to write down, you need to document, and because they have this chart, they have this cardex, and the cardex that has been written on that cardex is a specific, there's the name of your patient, the chief complaint or the impression or the diagnosis by the doctor, and then you are putting the diet of the patient. You are also putting the and that cardex, the management, like a short or a bird's eye view or a short glimpse of what does the patient needs, like stool exam or urinalysis. So pretty much everything. That's basically the short copy of your chart. Well, apart from the documentation process, there's also the third one that I am having to struggle with. It's the drugs. There are so many drugs that you need to know again. Though we have pharmacology way back in college, and we learned so many drugs, so many, like the classifications on how does this work, or the exact route. But of course, there's again, it's really also important to know as nurse in general. You need to know the 10 rights of the patient before giving the drug, which I was able to remember. At least, because that's very important as well if you're giving medication to your patient. But in the ward setup, it's different because you're not just only dealing with one patient. You're dealing with too many patients: pediatric patient, adult patients, medical surgical cases. So pretty much everything. So there's a different type of drugs that needs for this specific type of disease, and there's this specific type of drug that needs to be given, like let's say for example, pain medication for post-op patients. Because in my ward right now, we're taking post-op patients, medical cases, and medical cases, and also pediatric patients. Pediatric patients, I'm not really a fan of it, just to be quite honest with you guys, because you know, pediatric patients doesn't know how to verbalize their pain or whatever they feel. If you compare that one to an adult can basically speak, so it's easy for you to communicate with them. Whereas to the pediatric patient, you really have a hard time to talk to them because they cannot verbally express. So basically what they do is just to cry out loud, and sometimes it's a little bit annoying and it's quite frustrating because you don't know what you're going to do, even though they have their watcher or their mom or their dad. And sometimes when they see me going to the room, like wearing my white uniform, because that's my uniform right now, I'm no longer using a scrub suit, so they tend to cry because they are afraid, or they have this notion that a nurse who enters a room is going to give an injection. So basically I think that's pretty much of a stigma, like not really a stigma, but yeah, they tend to get, you know, afraid of people or per person who wears white uniform, because they are been told probably by their mom or their father or something like that they will be getting injected. But of course we cannot blame them. So yeah, so that's basically my third thing that I am having struggle with, like the medications. There are a lot of medications, but of course I know how to calculate my drugs, because it's just a basic calculation. But of course you need to understand the concept as well on that specific medication, because in the operating room, which I was assigned before, we only give pain medications, we only give like anesthetic medications, and yeah, that's pretty much it. If you're a circulating nurse, by the way guys, sometimes the surgeon might order antibacterial or antibiotics, like IVTT or intravenous fluid, via intravenous fluid. So once that surgeon will order a specific antibiotic, so like especially because, but basically guys, some antibiotics will be given prior to the surgery, but there are also surgeries that needs antibiotic like while ongoing. But most of the time, giving medications is already been given to the anesthesiologist, because they are the one who's in control with giving drugs. So pretty much they are the one who's responsible for that. So the nurses are actually, I'm not saying that they're safe, but of course they can just give the jab to the anesthesiologist. However, if the patient is already done with their surgery and then they were brought to the post-anesthetic care unit, the anesthetic or the post-anesthetic care nurse or the PACU nurse will be the one who's responsible in giving the pain medications. So most pain medications, I know that like Perioperative or tramadol or ketorolac, those are the medications that we usually give. There's sometimes there are also pain medications that, because most of the pain medications, by the way guys, are given intravenous. So those are the things. Sometimes paracetamol intravenous. So yeah, and sometimes we give diphenhydramine if there are any allergic reactions that pain medications. And what else? Yeah, I think that's pretty much it. So it's basically straightforward in the operating room. If you compare that one to the ward, it's way different because again, you are taking care of a lot of patients and you are preparing a lot of medications, like literally a lot of medications. For example, you're preparing for a respiratory patient, not respiratory patient, but a patient who has respiratory problems, or like such as pneumonia or COPD. So you are giving medications like salbutamol or other pain medications, or yeah, other pain medications. Of course, tramadol is already given. And sometimes you are giving other types of medications that you need to mix. So like that's what we call cocktail. So those are the things that I actually pretty much remember when way back when I was a student. But of course, since I am assigned in the ward right now, I'm still thankful because I was able to learn again. I had a recall on the things that I've learned way back when I was still in college. And good thing that my preceptor right now is really helpful. She's actually, I really like her style of teaching because she is just like a mom, really, because she's already been, she told me that she's already 40-ish, and she had already had a son who's already 18 years old. So that's why I like the way she teaches me, because she likes like a mom, if that makes sense. Yeah, and basically it's a spoon fed. I'm not ashamed to tell you guys that, of course, I'm not ashamed that I may have a struggle in terms of doing ward duties, because again, my exposure was in the OR. So yes, I think that's about it, guys, about my struggles in the in the ward setup. But again, I do believe that learning is still a continuous process, and learning shouldn't stop there on the four corners of the wall. And I mean, learning in the operating room doesn't stop. Learning in the hospital setup doesn't stop. Learning in general does not stop. So basically, you need to learn and learn and learn, and you will be able to use those learning as you go along to your journey to your nursing career. So basically, I'm still in a learning curve right now. I'm learning all the process that needs to be learned, because again, in the ward it's different. There's a lot of things that you need to do, and whereas in the OR it's really straightforward. Though I know that even if it's a straightforward even if it's straightforward in the OR, but still you need to use your brain, you need to use your mind. Well, I must say that I am confident in the operating room setup, so that's why I really wanted to go back in the operating room. But of course, it's good also to be a ward nurse, because it's gonna be your foundation on how you're gonna be doing well in that whatever, if you're gonna be assigned in a different area or in a different special area, like in an ICU setup, or what else, ER, because you need to know the basics. That's really important. Well, I think that's pretty much it, guys. I'm not gonna be taking myself too long filming myself because I'm a little bit sleepy right now. I've been awake, actually, I don't know how long I've been awake, guys. Like, I've started, I do have 2 night shifts. I mean, I'm still lucky because I only have 2 night shifts for now. But again, since we're working in long hours, so that's why I'm a little bit sleepy right now. So I need to sleep and to regain my strength. And hopefully I'll be able to do another video. If you want to ask something, if you want to make some suggestions about anything that talks about nursing or anything under the sun, I can definitely do that one for you guys. Just leave a comment down below, and don't forget to click like this video. If you like this video, just give it a thumbs up. And yeah, I'm gonna be seeing you soon onto my other video. And yeah, and I'm just gonna be taking you guys again to my journey. Hopefully soon if God's will, and hopefully I'll be able to bring you to my other, nursing journey in the future. So this is Mizar. Thanks for tuning in, and enjoy the rest of your week, and have a good day. Don't forget to be awesome, guys, as well. Bye for now.